Good evening, everyone. It's Wynn Brown here with Haywood Healthcare's update for Wednesday, May 13th. I hope you all had a spectacular day out there. It's gorgeous. Came home and mowed the lawn a little bit to try to catch up on it because it's growing so fast. And here I am a little bit late getting to you this evening, so my apologies. Let's look at our testing right off the bat. We have collected 3,545 specimens. We have received 2,845 negative results, 414 positive, 37 indeterminate, for a positive rate of 12.6% for cumulatively, and the state rate is down to 19.8. In Worcester County, we are creeping up on 8,000 total cases, 7,959. Franklin County inching toward 300 at 297. At Haywood Hospital, we have just one patient who has tested positive for COVID-19 and 5 patients that we are awaiting their test results on. So that's where we are right now. Just a little update, Thursday, tomorrow morning, there may be some delay on Woodland Avenue as there's being some fiber optic laid for our radiology department. Traffic will flow, but just to note that if you're wondering why there might be a little hiccup in traffic on Woodland, it's because of that. Also at Haywood Hospital on Saturday, we have a major power shutdown as we swap out one of our major breakers that we had to have built for our system. And so that means that our cafeteria is going to be operating a little bit differently. We'll have a continental breakfast at Haywood. Lunch will be salads and sandwiches provided by the Ale House. So no hot food in the morning or at lunch, just as we prepare for that major power swap over. So please pay attention to that. Also a note of appreciation from Dr. Andrea Demore. She writes, practicing obstetrics and gynecology in this pandemic has been challenging, and the glut of emails I get is certainly evidence of that. However, I bet it is nothing compared to the inbox of Dr. Vinod Mahan, our infectious disease specialist. I want to thank him for answering my questions each and every time. He gives responses that are thoughtful and evidence-based. For every one of my questions, I know he has to be addressing ones from multiple sources and other specialties. So from one clinician to another, thank you. I know our whole community is grateful for you are fighting this with and for us, Dr. Andrea Demore. So thank you, Dr. Demore. Some other thank yous, the Estelle R. Ford Future Nurses Scholarship that was established in memory of a 1943 graduate of our nursing school, provide lunches to our Watkins 1, Watkins 2, Geriatrics, OB, and ICU teams today. Estelle's daughter, Marjorie Fisher, coordinated the donation through Suzette's Breakfast and Lunch Shop, so thank you very much for that thoughtfulness. The Community Gift Card Fund held at the Gardner Ale House provided meal to Athol Hospital's facility and housekeeping across 2 shifts, and there's a photo of that. Chair City Church, which has been super supportive of us throughout this pandemic, provided 3 meals to our ED at Haywood Hospital. And Hub and Liberty Mutual provided meals through their joint Fueling the Frontline initiative at Haywood, and I had that lunch today. It was spectacular smoke shop lunch, and I really enjoyed it, and was really some of the best coleslaw I've had in a long time. I am a fan of really good coleslaw, so thank you very much to everybody for that. As we close out Hospital Nurses Week for this year, we'd like to thank everyone who has provided food and gifts to help us celebrate. Meals were provided by Gardner Cinemas, Domino's Pizza, JK Crossroads, Red Apple Farm, Chair City Church, Tom and Deborah Kane, Hub International and Liberty Mutual, Gardner Ale House, and friends who have supported our gift card there. Raffles were provided by Christine Whitcomb. Those were our Haywood Strong Bags, John Sport Shop, Real Heroes Wear Scrubs, and We Got This shirts. The Velvet Goose for the Healthcare Hero gift basket that I'll announce in just a second. Sharp Image for Haywood Strong Apparel that you see us wearing a lot of places, and all the surprise donations we received throughout the week. So thank you everybody for making Hospital Nurses Week something special for everyone in the midst of the crisis that we are dealing with, and we are dealing with it exceptionally well as a community. And as you know, we got to keep at it, and we're doing it for you, and we appreciate what you're doing in return for us. So the end of Hospital Week, Nurses Week raffle, our Healthcare Hero gift basket, courtesy of the Velvet Goose and our good friend Patty, goes to Charlene LaFosse at Athol Hospital Patient Registration. So congratulations, Charlene, on that. And just a reminder, as I close out tonight, we are working on reopening and ramping up all our services. We are in good shape from a PPE perspective overall, although we still need you to keep providing us PPE, our community sewers in particular. And those of you that are doing 3D printing for us, please keep supporting us. But we have started opening up to urgent surgeries that used to be elective, and we'll be moving more toward elective surgery. And also our radiology is open, our practices are open. And so, as I mentioned earlier, we are seeing a lot of people come to us who are far more acute than they normally would have been because they waited too long, especially to come to the emergency room and urgent care. So please access the hospitals, access our practices in a timely manner so that we can keep you healthy and well now and well into the future. So with that, thank you for all you've done to support us this week as we continue our journey to be one of the best community-owned health systems in America. Good night.